and then we'll start this, and then attendees will start coming in. So,
Okay.
All right. Good morning, everybody. We see attendees starting to come in, so we'll take just a couple minutes. I know I had a few people reach out about the meeting this morning. Thank you for coming to the May Galion Safety Council regular meeting. For those of you who got the email, we are going to be doing an extra meeting this month, next Wednesday. We're going to be doing the QPR training, gatekeeper training, which is very important right now. And I think the two topics in May with mental health awareness really go hand in hand. So I'm going to let Stacy go ahead and come on and do some BWC updates for you real quick. And then I have a few more before Mr. DeCamp gets started.
Thank you, Miranda. Hi, everybody. Stacy Harrington here with the Ohio Bureau of Workers' Compensation, your employer services specialist assigned from the Mansfield Service Office. I have just a few things for you from the BWC. The first and most important would be that for all private employers, the BWC did send out your estimated annual premium letter at the end of April. So you should all have them by now. And what I hope, and if you haven't done it yet, I'm encouraging you to do so, is that you've looked through that packet. It was kind of a thick envelope, and it had in there how we've estimated your payroll and your premium for the upcoming 7/1 of 22 through 7/1 of 23 policy year. We really, really want you to take a look at that. It is entirely possible that your operations have changed or something shifted in your business. You've increased or decreased payroll. If that is the case, you should reach out to us so we can adjust that. So you're paying appropriate premium throughout the policy year, not too little, so you're stuck with a big bill at the end of the year, and not too much. You know, we don't want you to pay too much in your premium. So please, please, please take a look at it. If you have any questions or you don't think you got your letter, please reach out to me and I will help you with that. The most important thing from all of that is that you all private employers, every single one in the state of Ohio has an installment that is due June the 21st of 2022. If you pay your entire estimated annual premium by that due date, you do get the 2% early pay discount. So that's something to think about, you know, especially if it's sizable at all. And that you can pay online at bwc.ohio.gov, or you can pay it by calling the 1-800 number, 1-800-644-6292. Also wanted to just go over that the BWC does have virtual training classes offered here through the end of May. The first is an electrical safety maintenance class that is May the 23rd through May the 25th, a 9:30 through 1:35 p.m. class. We also have what is one that's near and dear to my heart, and it's the Controlling Workers' Compensation Cost class. This is sort of my wheelhouse. This is how we calculate your premiums, how claims impact what you pay. It's a really good class. It's a very comprehensive class. If you want to learn more about all of that and sit through a class on that versus, you know, just trying to navigate what you see online or anything like that, it is on May the 24th and 25th, 9:30 to 12:45 p.m. each day. And the last one is hazard materials and waste, shipping and reporting requirements on May the 31st, a 9:30 through 2:15 p.m. class. And also, you know, Miranda did send this out in the email, but I just want to re-emphasize that we are going back to in-person meetings effective July 1. And that is super exciting for us. We are also reinstating the BWC rebate. So there is some more information on that forthcoming, but we're excited to see everybody in person in July. Yay. All right, Miranda, back to you.
Yay. So like Stacy said, we're super excited coming back in-person meetings in July. I'm going to be sending out a Survey Monkey, just a quick survey for those that regularly attend Safety Council meetings. We're thinking about changing the time from a lunch to a morning like breakfast. For those of you familiar with the Galion area, we don't really have a great place to be able to do lunch for 60 to 90 people comfortably and get in and out in time. So we're talking about moving to a breakfast kind of idea where we would just have coffee, donuts, and some fresh fruit and water out, and moving the location as well. So start thinking about that and how it would look. It would still be on the third Thursday of the month. We would just, meet at 8 o'clock, and at 8:30 on the dot, our speaker would start. So just keep that in mind. The best part I think our Safety Council members will like about the next fiscal year is that there's no semi-annual reports required. Yay!
Yay!
So I haven't had to deal with those yet since when Janelle retired. We went straight into COVID and we didn't require them then. So it's a good thing, but we'll have some more updates for you. Like I said, watch for that survey. But without further ado, I'd like to introduce Brad DeCamp. Brad has spoke for us before. May is Mental Health Awareness Month. So I thought it was important again to bring him back, just, as we have new people in different positions. You may have new employees, some, things you just need to revisit. So I'll let Brad get started. I'm going to be sharing my screen with his PowerPoint. So give me just a minute to get that ready. And here we go.
Well done, Miranda. I always trip over getting PowerPoint to start on Zoom. But you did that very well. Thank you. So yeah, hi everybody. This is Brad DeCamp. It's good to be with you today. And I appreciate Miranda and the Chamber reaching out to talk a little bit about Mental Health Month. So what I was going to do this morning into the very early part of the afternoon, I will say, is talk a little bit about ADAMH, what it is that we do, who we partner with, and then talk a little bit about some things that are going on currently, along with some other statistics that we'll talk about and go through. So I will go ahead, and if we want to go ahead and skip the brief intro slide, I will just say, for those of you who don't know me, I have been at the board for 6 years now, and about 5.5 of those years have been as executive director. So I came in when Jody Demo retired, and have been here as director since October of 2016. So if we could go back one slide. Thank you. So just very quickly, our board, I think there are sometimes people who aren't real clear what an ADAMH board is and how we're comprised. So I wanted to touch on that very briefly. We are a 14-member volunteer board. An ADAMH board, or Alcohol, Drug Addiction, Mental Health Board, is basically part of government that exists between the state and the county. So for our board, we have appointees that are appointed by the state of Ohio, and we have appointees that are appointed by either the Crawford County Commissioners or Marion County Commissioners. And we do split those 14 members between Crawford County and Marion County. The members represent different perspectives. They may be individual consumers themselves, or they may have family members, or they may be concerned about mental health or addiction perspectives. And our goal really is to ensure that services are available to those in need when they need them. One distinction that I think sometimes is confusing for people is that we as a board do not provide direct services. So you don't come to the ADAMH board for counseling or for medication or anything like that. We must contract with providers that are certified by the state of Ohio, who have those criteria and available services to make sure that that care can be provided there. So I'll talk a little bit next about what are some of the things that we do as a board. So, and I'm not going to go through all of these, but one of the things that we are required to do is to basically develop this notion of a continuum of care or community support system for every person who might have either a substance use disorder or mental health issue within our 2-county area. And just as a reminder, we do serve both Crawford and Marion counties. The other thing that's important on this particular slide that I wanted to touch on is that we do have a call to protect the the liberty of individuals, mentally ill persons, so that they may be treated in the least restrictive environment. And so what that means is that there are legal processes that go on when an individual becomes a harm to either themselves or other people. And in part of that process, what we have to do is we are going to ensure that that process follows a very strict set of timelines and rules and regulations so that the individual's liberties are not infringed on any more than they have to be. But there are sometimes public safety issues that come up that do require that type of a situation to be invoked. So we can move on to the next slide from there. We also work very closely with partners. We work with our children's services partners in Crawford County. It's a combined agency, so Job and Family Services. We also work with the Developmental Disabilities Board. The schools are close partners as well. And one of the things that we do in terms of working with them is making sure that services are going to be responsive to their needs, in addition to the being responsive to the needs of the individual recipients of those. And the other thing that we do that I would touch on this slide is that we do promote the participation of individuals receiving those services in the planning, delivery, and evaluation of what we do work. And we do that through a number of ways. We do that through focus groups, we'll do that through surveys. And then, as I mentioned with the board composition, we also have individuals who have personal lived experience on the board, either through addiction, mental health, or both. So we'll move on from this slide and talk a little bit about our priorities. We do have 4 overarching priorities, which are looking at trauma-informed approaches and resiliency. Trauma, if you're not aware, there are what are called ACEs, adverse childhood experiences, that individuals can deal with in their childhood, and they have a certain impact or trajectory on our health and mental health as we grow older. And so what we're thinking about in this particular priority is how we can work collaboratively to help provide services that are trauma-informed, but then also build resiliency, which is the ability to kind of come back from that traumatic experience. We're focusing heavily on prevention, and we will talk a little bit more about the specific services with prevention in just a few moments. We also focus on services to criminal justice, and that includes individuals who may be incarcerated at a state prison, maybe at the local jail, who are coming back into the community and thinking about how we can organize services differently or more effectively for those individuals. And then lastly, recovery support services, which are things that aren't typically what you would think of with maybe mental health care. It's not going to be, seeing the doctor, getting medication, maybe seeing your case manager, or having a counseling session. These are things like transportation, housing for both mental health and addictions, or for both mental health and addictions, and other services that are not typically going to be what you would deem traditional counseling, but we know that we need them because they help individuals stay in recovery. There are 2 other additional focus points that we've picked up on recently. One is workforce, and I don't have to tell you how challenging workforce is. We certainly are seeing that as well in our field. And then also provider coordination, making sure that with any new providers that come into the area, that we are trying to include them and make sure that with the limited workforce that we do have, that the providers base is working together as closely as possible to make sure that there isn't a duplication of effort. Moving on from there, just to kind of delineate who our partners are. I'm sure many of you are familiar with community counseling services. They are now community counseling and wellness centers. That's a merger between the former CCS and the Marion Area Counseling Center in Marion. So they are now going by the new name, Community Counseling and Wellness Centers. They have the 2 separate sites. They have the Bucyrus campus and the Marion campus, and then other assets that are attached to the Marion campus as well. If you did not know, the Bucyrus campus of CCWC also has a federally qualified health center co-located at its site. That's 3rd Street Family Health Center out of Mansfield that is located there with them. We also work closely with Marion Crawford Prevention Programs, which does the TI and Junior TI program. Together We Hurt, Together We Heal. Family Life Counseling, which is actually based in Galion. We have a small contract with them currently. We also have a small contract with Alpha 12 Step, which does recovery housing in Bucyrus. And I would say that we're consistently trying to think about, are there additional needs, service provider needs that might help us meet service or provide services that aren't currently being provided in a way that we would like to see them provided. So that's something that we're constantly evaluating in both of our communities. In terms of the services, we are required by law to offer a wide array of services. So I'm going to highlight a few of those in this slide. We do offer inpatient mental health and withdrawal management, which is also known as detox. So that would mean that if someone needed to go to basically what might be commonly referred to as rehab or an inpatient psychiatric placement, those would be things that the board has to coordinate and also provide levels of coverage for. We also do traditional outpatient and mental health addiction services in both of our counties. We provide medication-assisted treatment. We also do prevention in the schools. I mentioned the TI and JTI program, but we also do the signs of suicide. And I'll speak more specifically on signs of suicide a little bit later in the presentation, but that's available in all the school districts in both Crawford County and Marion County. We also do recovery housing and permanent supportive housing, and we have a new project that we're currently beginning a journey on in Marion that will kind of replace some older housing units that we have are going to be disposing of and making a new project out of that. So I wanted to talk a little bit about what's on the horizon for future things. I touched on workforce already, and I won't belabor that because I know all of you are struggling with that as well as we are, but it's particularly problematic in terms of how the state has changed the Medicaid program over the last few years and the challenges around billing and having qualified staff to capture the maximum reimbursement that's possible. And to just give you a real quick tangible example of this, prior to about 4 years ago, there were only 10 Medicaid services that were able to be reimbursed for community mental health or addiction providers like community counseling. That number of services has increased, but it's also being paid at different levels. So if you had a licensed independent social worker who's providing services, you would get a higher rate of service than you would if you were using a counselor that was not independently licensed or might have a different type of credential. So that's made it very complicated and made the workforce even more challenging because those types of individuals with higher licenses, like independent licenses, psychologists, MDs, they're hard to find. And so that has created even more of a challenge for our workforce. And what I wanted to do over the next few slides is I'm going to highlight them here and then go into a little bit more depth on some future slides. I wanted to spend some time talking about 988 and the crisis services continuum, and then also suicide prevention. And I'm very happy to hear that QPR is going to be offered at an upcoming meeting. I think that's absolutely the right way to go, and I appreciate the chamber helping organize that that model. But there's a few others that I wanted to touch on as well. But let's go ahead and move forward and talk about 988. And this is a map of Ohio. And if you've not heard of 988, what 988 is going to become is the new suicide prevention lifeline. But it's also going to be a number which will activate crisis services. And so this is something that's coming very soon, and it will be, the plan is to go live in July. So you'll start seeing some additional marketing from the state of Ohio on this. And I wanted to highlight just very, very quickly the Marion Crawford area. So I don't know if you can see my cursor or not, but thank you, Miranda, for doing that. And you'll see that we have this green color that is also similar to some counties east of us. And so what that means is we are using the same call center that they are, but the nice thing about our situation in Marion and Crawford counties is that we're using Pathways of Central Ohio. Pathways of Central Ohio has been engaged in Marion County going on for 3 years now, and they're newer to Crawford County. But my point with this is that there are some areas in the state of Ohio that you see that cover very large regions. And so in some instances, people will be calling in from counties that do not have that local connection to their call center. So with us, we do have at least some comfort in knowing that this entity that's working with us in Pathways of Central Ohio is at least familiar with our two counties. And it's not like we're going to be calling Columbus or Cleveland and they're not going to have that experience with our provider base and know about what's going on within our local systems. So this is going to be a challenge. It's going to be a heavy lift for the state. It's been, I think, challenging to, it seems easy enough to develop almost like a 911 number. And, you know, it doesn't seem overly complicated on the surface, but it has been very challenging work. And so we're very hopeful that when the individuals who call into this line do so, that they're connected appropriately, and that does not create any backup, and it goes very smoothly. So that's the goal for 988. And again, it's going to be the new 911 emergency number for crisis services and also suicide prevention as well. But I wanted to make sure we touched on that today before we close the presentation. There's another crisis type of service that I wanted to make you aware of, and it's called MRSS, or Mobile Response and Stabilization Service. This is a relatively new service to Ohio. It came along about 4 years ago. And really what it is, it's about this, it really is, the name says what it is. It's really a mobile response to crisis situations. And so it's basically that, and kind of part of the state's response to how to address crisis services in addition to other problematic services around youth that are in crisis and families that are in crisis. And so this is something that we're taking on here, trying to evaluate how we can do it. I will tell you that even though it's kind of a Medicaid funded service, it's very challenging to recruit and to meet the criteria that the state has laid out for MRSS. It's a great idea, but I think in rural counties like what we are in both Crawford County and Marion County, it does present challenges for us. But I wanted to make you aware that that's something that's planning to move forward as well. And we're kind of evaluating what our options are with MRSS. So moving forward from MRSS, I am going to talk very briefly about QPR, since we're going to be hitting on that in the future. This is something that's a 1-hour training, and it is very effective for gatekeepers. So we could go ahead and move to the next slide, and I'll just touch on the gatekeeper component, which is the second bullet there, but it's looking at these types of individuals. You'll see that we also talk about supervisors, foremen. So it's a very important and appropriate, certainly for places of employment, to be able to understand what some of the warning signs are that they can begin to work for. So we can go ahead and move forward from QPR. Working Minds is another kind of business-specific suicide prevention program. It's a little bit longer than QPR. It's about 2 hours as opposed to the 1 hour for QPR. But I would encourage folks to talk to Christy Eckert from Marion Crawford Prevention Programs if you're interested in learning more about Working Minds. So I won't belabor that slide too long. Talk a little bit more about what's coming on the horizon and some things that we're seeing, especially around pardon me, concerns around vaping. That continues to be problematic for our high school age kids. And so we're trying to bone up on our suicide or SUD prevention, substance use disorder prevention, to help make sure that we're hitting that vaping concern. Housing, especially mental health housing, I touched on earlier, into the new project that we're looking on doing. And also just what the future is of community behavioral health. We've recently seen an investment from the state of Ohio, and our board is working on a plan as well for workforce and how we can partner with our local agencies and also other local funders to help enhance the behavioral health workforce. I think there's some question of integration with primary care or other ways that we might be able to organize behavioral health. I think this is a very challenging time, and it's making us think, I think, very, very creatively and critically about how our system has evolved and what we need to do to make sure that we can ensure that those services are still available to individuals who have, whether it's a serious mental health issue or addiction issue. So from here, I wanted to just touch on some very basic information around mental illness, but it's basically a disorder that's a diagnosable condition that affects a person's thinking, emotional state, behavior, and it disrupts their life areas. For example, their ability to work, carry on daily activities, and also engage in relationships. This is a good slide that I like to always include in presentations like this, because it talks about what people see and what is actually happening. Whereas you may see somebody who's, not, or that may be lacking motivation, they may be laying in bed all day, they may be being distant or something like that. And what we know is going on really with serious depression and other conditions is that there's this exhaustion that comes on that is just zaps people's energy and really limits their ability to function as they would normally. So I won't go through all of these, but I would just encourage you to go refer back to that if you start to recognize some of these things maybe in the workplace, and maybe these are new things that might be coming up in employees exhibiting, but it might be something else that's going on instead of just, well, they're not doing well at work today. Mental health conditions just aren't the result of one event. There's genetic involvement, environmental involvement, and lifestyle. And certainly a stressful job or home life makes someone more susceptible, as do traumatic life events. And I talked on the adverse childhood experiences earlier, but it could be something else. It could be another traumatic event that could happen in adulthood as well that could play into this as well. I'm just going to touch on some common mental health conditions. I'm going to try to move a little bit more quickly because I know we're getting a little bit closer on time. But the most common that we see across the board are anxiety disorders. That's the most common that we will see with all those. Major depression is then the next at the 6.9%. 2.6% have bipolar disorder, and then 1.1% have schizophrenia. And I think a lot of times in major media and sometimes in movies and other things, we throw these terms around, or we hear them thrown around, and we think that they're very pervasive and things like that, like schizophrenia, but actually schizophrenia is not as common as it is sometimes portrayed to be. And the other thing to keep in mind with all of these conditions is that there are treatments that work and they are effective, and people can manage their life successfully once they get into treatment. Moving forward with a few other graphics here. Again, this just kind of highlights 1 in 5 adults in America will experience mental illness in their lifetime. 1 in 25 will live with a serious mental illness. And then 1/2 of all chronic mental health begins by the age of 14 and 3/4 by the age of 24. And so what that speaks to is the requirement that we identify and then intervene early for those individuals who have problematic issues that do need to be addressed earlier in the life cycle. And while I don't have it in this presentation, one of the things that we do know statistically is that individuals with serious mental illness do have shorter lifespans, anywhere from 10 to 25 years off the general life expectancy, because what happens is with their mental health issues, they are not as likely to take care of their health, and that leads to other chronic conditions as well. I'm just going to touch on these. These are from NAMI, the National Alliance on Mental Illness. If you're not familiar with NAMI, I would encourage you to learn more about them. Not only are they a great resource and support for us in our community, we do have a local NAMI affiliate that covers both Crawford and Marion counties, but they also do great research on the national level. And this was just kids' mental health amid COVID-19. And this was a survey that NAMI commissioned. But just to touch on some of the key points, almost or over 3/4 of parents surveyed are thinking about their kids' mental health, and 44%, so almost half, are very or somewhat concerned about their kids' mental health. And I think that we're going to continue to see that worry continue over time. I don't think we're going to know the overall impact of COVID, especially on the younger kids, for many years to come. And so we're going to have to work on that as a system to try to provide help when needed. There are a few other one-pagers that I would offer to you. These are some warning signs of mental illness. And I'm not going to go over this one in detail, but it highlights some of these things that, again, maybe as an employer, you might see in terms of changes in behavior that are maybe sudden or drastic. And so you might want to consider these when you're wondering maybe what's going on with that individual. I think I have one more that I wanted to touch on, and this is the youth and young adults, and I won't touch on this one because the other one had some information on that as well. But if you just look at to the right, you see some statistics there, and young people, 1 in 5 report that the pandemic had a significant impact on their mental health. Frankly, I think that's a little bit low, and I know that they were kind of splitting it, and this is just one study, between adolescents and young adults, but I think that those numbers are going to continue to grow over time. So moving forward from this, I did want to touch on suicide because that is a concern, and I won't belabor this because, again, I know there's some additional training, and I do think it's important to at least bear out, but suicide is the second leading cause of death for people aged 10 to 34. So that's our youth. Those are our young adults that are at risk. And then I think the other concerning thing that we've seen in working with Crawford County Public Health is that working age group, that 35 to 54 group as well, has been impacted by COVID as well. And there are some other factors that are other groups that would have some higher suicide rates than others. And I won't go through all those, but certainly rural areas and workers in certain industries like construction, manufacturing, those are individuals that we would need to be concerned with as well. So just a couple others on suicide. And again, not going to go through all of these, but these are warning signs of suicide. Isolation is one, feeling like they're a burden. Increased substance use could also be something to look for. And also when you hear someone talking more specifically about a clear plan in terms of how they would take their life, those are definite warning signs, and you would want to engage that person and get them connected to emergency services as quickly as possible. Moving forward, signs of suicide, that's our school-based universal program. It's a screening program that is middle and high school. And so for most schools in the county, Community Counseling Wellness Center provides this. I do apologize for the not capitalizing that in the second bullet and using the correct acronym. I will fix that. But it's basically a way that the staff can triage a student and tell if they're low, medium, or high risk. And if they're low risk, they'll get education. If they're medium risk, there will be a more structured intervention. And if it's high risk, there will potentially have connection with actual treatment services. So that's kind of how SOS works. We've been supporting this program for many years. I think I have one more slide on SOS and then we'll move forward. But these are the goals. I'm not going to go through all of these, but obviously the first and foremost is to decrease suicide and suicide attempts by increasing knowledge, student knowledge, and there's also a parent education component that goes with this as well. So moving on from there, again, mental health first aid is another program that we offer through ADAMH. We are expanding that in our business programming. So if that's something that you're interested with, I would encourage you to talk to Miranda, and I'd be happy to have a further conversation about mental health first aid. And we can move forward from there. And that's just a brief overview of what mental health first aid covers. The one thing I will say about mental health first aid is that it's not a training that you can just show up to. There is an online component that has to be covered, and because it is a proprietary program, they do have some pretty strict oversight in terms of those requirements that have to be met, so that once you're certified, you can demonstrate that that has been met. So we can move forward from, and I'll just touch on this quickly from mental health first aid. As far as employers and what they can do, there's this acronym of LEAD, leadership, effective communication, adapt, and double down on access. And I think one of the big things that I would just say is, as employers, it's important to create that safe space for individuals to talk about mental health issues. And if there's that safe space or place at work that they feel comfortable talking to somebody about it, then that could be an effective intervention point. We want to try to capitalize on that if we can. Moving forward from that, again, sharing signs of common mental health conditions, we've given some of those as well. And then from there, promoting resiliency and some other areas as well. So I think, yeah, where are resources? I didn't want to go on too much longer because I know we're pretty close to being out of time. These are some national and local resources. You see, you have the National Lifeline. As I mentioned, that's going to be switching over to 988. We do have a crisis text line, which is available by texting the number 4 and the word HOPE to 741-741. I do have some personal experience with that one, and I can definitely vouch for that one, the crisis text line. We do have both the Marion and the 800 number for Pathways of Central Ohio. Contact Crawford County is also working with us. We have community counseling and wellness centers, and then lastly, the prevention program number as well. So I think what we'll do is, I think that might be all that I wanted to cover. Here's some additional resources. And then if you want to go ahead, Miranda, and move forward. I'm not going to go over parting thoughts, just other than to say that I think there will be a lingering impact from COVID. I mentioned earlier in the presentation that 1 in 5 adults will have a mental health issue in their lifetime, but 5 of us have mental health. And so I think it's going to be interesting to see how that plays out in terms of the pandemic's impact on all of our mental health moving forward. So for next, I'm happy to answer any questions. This is my contact information. Email and my cell are the best ways to reach me, and you're certainly welcome to contact me by either of those. So I very much appreciate your time. I'm sorry if I went over a little bit, and I hope you found this helpful. Thank you.
All right, start my video again, sorry. If anyone has any questions or comments or anything, the chat at the bottom, you can type in there, or you can type in the Q&A. Real quick on my point, from my stance, Brad, I came from a manufacturing background, and I have heard the statistic that, you know, the the males 30 to 50 in manufacturing are some of the most highest, you know, that contemplate suicide. Like, do you see that instance in our county and in our area as well?
Yeah, and I would say definitely that's something in Crawford County that has been borne out by the statistics that we review with Crawford County Public Health. And so that's why we thought it was very important to reach out to our business partners, to our chamber partners to say, can we create a space for this training to go on so that we can at least do some education and maybe potential intervention points, create those spaces for individuals to, if they have a coworker that they're concerned with who may be making some of those statements that I put on earlier, that they can flag that and start to have that conversation and maybe call in additional resources if need be. But yes, absolutely, in Crawford County, that's definitely an issue.
Okay, is there anything that we could like push out to our manufacturer chamber members or safety council members that, you know, maybe would be a great resource for that? Do you have anything? I'm looking at the attendees and I'm seeing some of them are from the manufacturing field, so that's why I'm asking.
Yeah, absolutely. I can work with you to get some additional information out. I would just encourage everyone, QPR training is just an hour. It's going to cover a lot of the things that can talk about. I think one of the things, again, is just having the ability to have the conversation and letting folks know that you do genuinely care about their mental health will go a long way in creating that space. It's not going to be an open door for everybody because individuals, there's obviously a lot of stigma that still exists around mental health and mental illness and suicide, but we want to try to get information out to let them know that, and perhaps a better way is to have ways for coworkers to be able to recognize those signs, not just with their coworkers, but maybe their family members and themselves, and create that pathway that they can come forward and have a place to talk to someone.
Okay, thank you. I still don't have any questions that have come in, so at this time we'll probably wrap it up. For those who are on, I know Brad referenced the QPR gatekeeper training. That is what we're going to be doing Wednesday morning. So please invite anybody within your facility to log on and watch with it. It doesn't just have to be one person. It's just, I've went through it and it's great. And there are some things that you're like, oh my gosh, I would have never thought of that. So that's why I thought it was important to do it, especially around Mental Health Awareness Month, which is May. So thank you. That's all for today. We have two more. So next week and then in June, just 2 more virtual ones, and then we'll be back in person. So watch your emails for the survey coming out so we can set a time for July. So thank you, everybody. Thank you, Brad. Stacy, I'm not sure if you have any parting or anything from BWC, or if you just bye.
Nothing specific other than if you want to push out my contact information, I'm available. If you guys need me, anything BWC related, that's why I'm here.
Awesome. Thank you. Everybody have a great day. We'll see you Wednesday morning. Thanks.
Okay.
Thanks, Miranda.
Thanks.
Bye. Thanks, Brad.
Thanks, Miranda.
Bye.
Thanks,
Thank you. Bye.
Bye.